Greetings, my name is Amy Todd Donato. Today I would like to share a video tutorial demonstrating a dorsolateral approach for ultrasound evaluation of the hip joint and the abaxial pelvis in dogs. We have no conflicts of interest to disclose, but would like to acknowledge Carol Jennings and the Educational Support Service team at Cornell University's College of Veterinary Medicine for their assistance in the production of this video. Ultrasound can be used in dogs of all sizes presenting with pelvic limb lameness to evaluate for hip luxation, osteoarthritis, and pelvic fractures along the abaxial portions of the pelvis. We have previously established the accuracy of this technique on cadaver dogs and in clinical patients. Imaging of the hip and pelvis region can be performed with either a portable point-of-care ultrasound unit or with a larger high-end console type unit. Either a microconvex or linear probe can be used depending on probe availability and the size of the dog. The patient can be imaged standing, sitting, or either in sternal or lateral recumbency. The exam is well tolerated without sedation in most dogs. Clipping of the region and application of ultrasound gel allows for best visualization. However, use of 70% isopropyl alcohol without clipping provides acceptable imaging of the osseous structures in most dogs. With the probe, we're going to place the marker so it's medial. So the marker of your probe is on the medial side. The probe is going to be positioned on the dorsolateral aspect of the pelvic bones. We're going to start cranial where we can see the iliac wing, and you can see this broad hyperechoic line with far field shadowing. So this is the osseous margin of the iliac wing. We're going to move the probe caudally to follow the shape of the iliac wing tapering into the iliac body and become more rounded and narrower, and then we can encounter the acetabulum and see the hip joint itself, and then it will flare slightly again before we come into the acetabulum. So here we're at the level of the acetabulum. We can see the triangular shape of the acetabulum, and to the right side you can see the edge of the rounded femoral head just tucked under the lateral margin of the acetabulum here. And then as you continue to look right, this is the femoral neck, and then the protuberance here is the greater trochanter. And as we continue to move caudal, we'll see the rounding of the ischiatic body and then the flaring into the ischiatic tuberosity. As you continue to move caudal, you can see the very narrow rounded margin of the ischiatic body. And as you follow that, this is the ischiatic tuberosity. A secondary approach to finding the hip joint would be to palpate where the greater trochanter is and place your probe right at the level of the greater trochanter. And from there, you can just slide your probe medially and dorsally, and you can find the femoral head seated beneath the acetabulum. And from that point, you can scan cranially into the ilium, or you can, starting from the hip joint, scan caudally into the ischium. The following are short cine loops of patients with hip and pelvis abnormalities. This first cine demonstrates a craniodorsal hip luxation in a large breed dog. When scanning from cranial to caudal, the femoral head is detected at the level of the iliac body and is located dorsal to the plane of the pelvis, consistent with a craniodorsal hip luxation. In this second example, scanning the pelvis from cranial to caudal identifies an empty acetabulum. The femoral head is located caudal to the acetabulum, abutting the ischiatic body, with ventral displacement of the femoral head and greater trochanter relative to the pelvis. This cine loop demonstrates osteoarthritis in a large breed dog. Imaging of the acetabulum shows it is abnormally flattened with large osteophytes. The femoral head and neck have reduced distinction due to moderate to severe osteophyte and enthesiophyte formation. A small breed dog presented with a dynamic subluxation. You can visualize the femoral head becoming unseated from the acetabulum and displacing dorsally with manipulation of the limb. In this medium-sized dog, there is a prominent step-like defect in the acetabulum consistent with a fracture. Concurrently, there's dorsal subluxation of the femoral head relative to the lateral acetabular margin. In this last example, ultrasound demonstrates a normal articulation of the hip joint. On examination caudal to the level of the hip joint, there is a prominent fracture in the ischium, characterized by a mildly widened step defect in the osseous contour and moderate surrounding soft tissue swelling and fluid within the tissue planes.